Hi guys, Dr. Nick here. Today we're going to continue our series on the LDI videos, just so you can get a better sense of what LDI is and how we physically use it. So today we're going to focus more on the kind of dilutions and how we kind of make up the different potencies of LDI. So in general, what we're trying to do is we're starting with a very concentrated form of whatever we're utilizing. So example is, if we have a yeast mixture that we use, we're going to start at a certain point where it's more material, but as we go along, we're going to dilute it down where it becomes less material, and sometimes in terms of even Avogadro's number, which is 6.02214, etc., 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 to the 10 to the 23 molecules per mole, that vanishes in terms of, at least from the science point of view, and I know that because I was a chemist before. Wow, I know, crazy. But the whole point is that after a certain point, we can say that some of these physical LDIs have normal material substance in them, so they're more energetic. Because as we go along, what we're doing is we're basing it on, if you think about, if you know anything about homeopathy, if you know Dr. Hahnemann, he used to dilute his different homeopathics from 100 to 1. So that would be 1C. 100 to 1 dilution would be a 1C. In this case, we're kind of doing the same thing. And this was kind of brought up by Dr. Ty Vincent. He kind of started this method. And then once we dilute it, we actually succuss it too. I know. So it is kind of homeopathic in a sense, because we're doing the same kind of understanding of Dr. Hahnemann, where he used to succuss it 99 times against a leatherback Bible in those old days. So we're doing it. We're succussing it after, and then we keep going until a certain range. So example would be, I have an example of my diluted yeast mixture. So here we have a lot of different yeast mixtures in terms of dilutions, where we start from a 5C all the way to a 24C, but we even have more diluted forms if necessary for a patient. So once we have our dilutions down, what we do is we think through, based on our case history and sensitivity to the patient, we give a patient a certain potency. So no matter what that is, what we usually start with in terms of the physical dose of that potency is 4 units on an insulin syringe. So that's approximately 0.04 mils. I know it sounds crazy, but that's what we do. And this is an example of an LDI prepared, where we can see there's only 4 units covered there in terms of the LDI syringe. So once we have that ready, we give it sublingually, and then we let it sit under the tongue there, because, like we said, there's a lot of immune, we're going straight to the immune system over there with the lymph tissues, the immune tissues around there, to be able to get absorbed straight to the immune system. So after that, then we'll see a response, hopefully within 7 to 10 days, and when we don't, we would go to a stronger dose. So that's the difference between this and kind of homeopathy, where in homeopathy, you're actually going the opposite way in terms of less material things, but in this case we're going towards more material things, if you want to think about it that way. So I hope this video helped just to kind of understand of the basis of the different potencies. In the next videos we'll explain more in terms of dosing, the scheduling, and different things that are available through LDI. So thanks for watching, and continue to follow me for the new videos coming up soon.